Hi, my name is Olivia Reynolds. I'm a licensed psychotherapist and owner of Healing Hearts Trauma. I am starting to make content videos for my patients as well as anyone else interested in learning about psychology and all the things that I'm wanting to share. I'm wanting to end some of the pop psychology stuff that's going around on TikTok, YouTube, and any social media, Instagram, Facebook. A lot of stuff I see is content that's not very evidence-based and or what I would presume to say accurate information. So I would like to help spread some awareness and educate people on just some of the content that I'm about to post. Today, my goal is to post about the therapeutic relationship. You might ask, why is that important, or why do I need to know about the therapeutic relationship? Well, one, it's important for you to know that you can find a safe place where you feel connected, safe, able to open up, and that your therapist or whoever you choose is going to be able to help you on your journey. When I talk about empowering journey to help people heal, it's merely your journey for whatever it is you come in for. Therapy is supposed to be about sitting in the chair and finally saying, I'm tired of myself or a situation. Something has to change, right? So we pick somebody through the lens of whatever we're looking for, right? Psychology Today, through your insurance provider, wherever you're at, searching, and you come across a person and you either look at their photo or their profile says something, right? Grabbing your attention, and you feel connected to the person to engage in services. Upon meeting them, you want to make sure your guys' goals align and you understand what the therapeutic process is about. So, in therapy, our goal is to guide you, motivate you, hold you accountable, make it a safe environment and space for you to grow and to discuss things that you need to discuss, as well as challenge you, but also make sure that you're doing the things that you want to do. With insurance involved, unfortunately, we have to show some type of growth or change because insurance wants to see baseline as well as progress. Now, if you are not wanting to use insurance for that purpose, or for people that want to do more of what's called talk therapy, vent therapy, the whole analytical Sigmund Freud approach, where you sit on the couch and week to week you come in and you ventilate your problems and you talk to the therapist and you don't really do a lot of intervention or change. So the Therapeutic Alliance is, again, supposed to be what you're looking for, and the person's supposed to be helping you change in some fashion. It's like art. You pick someone that you gel with, and that is going to give you the results you desire, just like when you go to the gym or to the physical therapist. The problem is, if you're not doing therapy after you leave therapy, you're not going to change. And my job is to make sure I'm seeing that each week when you come in, that we're looking for progress. We're looking to see if you're meeting your goals and doing your homework, or else we got to look at, like, why are you not doing them? What's stopping you? Are you really in the stages of change? Are you really ready to even be in therapy? That's another thing to consider. Am I ready? Because sometimes we're going because we're being dragged by our partner or work, or because other people have said it sounds like a good idea, or we've heard about it, the taboos of it. It's really a place for you to grow and change and to figure out parts of yourself that no one else knows and you feel safe about discussing, because this person is the gatekeeper to all of that. I also like to include in the Therapeutic Alliance that, again, you make sure that they're holding you accountable and giving you what you provide, and that it's not sided where the therapist is sharing too much about herself or themselves, and that they're actually teaching you some type of interventions and skills. For me, my integrative approach is using dialectical behavioral therapy, cognitive behavioral therapy, CFT, which is like cognitive trauma informed. And then I'll use some solution focus as well as motivational interviewing and maybe some person-centered. So very integrative from all the theories, and developmentally, I am more of a developmentalist theorist as well as a behavioral theorist. So I use a lot of stuff from trauma and attachment. I've been doing this now I started in the field in 2009, but prior to that, I was working in the field. So I've literally been in mental health around 19-ish years or so. And then I had it in my family, so that was enough experience right there. And so I have found that labeling people, right, with this lovely giant DSM, and excuse my dogs as they're running around. I'm in my office and I don't get much privacy. Even if I let them out there, they're going to make noise. So this DSM is the diagnostic manual that we use to label people merely for insurance. If you don't want to be labeled, don't go through an insurance provider, because they're mandatory that you have to have something diagnosable for us to treat you. If you want to go off the record, which a lot of people do, because they don't want it in the record or people to judge them or have some type of stigma, there are some of those that do sliding scale or self-pay to help people that don't want like recorded type of diagnosis in their chart. So that's very important to consider too with the Therapeutic Alliance, because there are a lot of professions out there where they're very afraid to open up and discuss these matters because of fear of if it gets in the record, then they might not be fit for any type of duty, right? So we got to be careful. I mean, I've had pilots, lawyers, doctors, all sorts of people, and if some things were disclosed, they might not be able to do their job. So that's very important to make sure your therapist knows, so that certain things are not included in the chart and discussed. But nonetheless, I have learned that I don't really diagnose people per se, but trauma. Everything to me is trauma derived. So all my videos that I'm going to be sharing with you is my knowledge from the years of evidence-based studies that I've done and conducted on trauma, as well as looking at it from the developmentalist lens with Jean Piaget and all the developmentalists that have found that usually it starts with nature versus nurture and the environment. And I'm a firm believer that every single one of us have been exposed to trauma, and it doesn't have to be physical abuse or sexual abuse. We're talking about just complexities of life. And those complexities affect our nervous system, right? And so many of us are neurodivergent because we all are hot-wired differently. And our 5 senses are activated because of that. And then we go into these automatic responses to protect ourselves. The body is a very cool thing, and the brain does a lot of things that we don't even know trying to protect us. Now, the people that care for us are the ones that are supposed to be protecting us from most things, but the brain and the body also has a responsibility too. So we're like animalistic in a lot of ways, and we go into these survival modes without even knowing we're doing it. So I want to teach you about this because I'm a firm believer that most of the stuff that you've experienced, that people probably told you that you have depression or you have anxiety or you have this or you have ADHD, is almost, and I can bet my life on it at this point, that it's related to some type of complexity in your nervous system not knowing how to respond, and or it has responded and now you're in constant survival mode and hypervigilance. So we're going to learn ways to figure out what your survival mode is when you're stressed, as well as how you attach to these situations and relationships because of it. And then you can learn to be a pretty healthy person. I'm a firm believer, if you know the disease, we can cure the disease. But if you don't know the disease, we're not going to cure it. And most of these in that book seem irreparable, and that's not true. It's learning and educating yourself and having a therapeutic alliance, someone that understands you and wants to walk through it with you and help you learn and heal. So nice to meet you. I look forward to spreading more awareness and advocacy about mental health and psychology. And if you need any type of services, please look me up. My name is Olivia Reynolds, owner of Healing Hearts Trauma. Thanks. Bye.